Um, I'm going to move on. And this is very exciting because I will be popping in two representatives from the American Nutrition Association. If you did not already know, it's actually been a year. So it's been a year. I can't believe it's been a year. Owens started this collaborative effort where we are basically giving you access to this wonderful education series with an exclusive 35% discount for our members. And we've had quite a few graduates already. And I have to say, we have only positive reports. So, Amy Smith, she's the Senior Director of Certifications and Advocacy at the ANA. She holds a master's in integrative health and became a CNS in 2020. And she's currently pursuing her PhD in mindful leadership in healthcare. We need a lot of that. Alyssa Doherty, she's the Manager of Nutrition Science at the ANA. And she holds a master's in nutrition and integrative health and also a CNS. She's dedicated to advancing evidence-based personalized nutrition, aligning with the ANA's mission of promoting scientific integrity and transparency. I know them, I've met them multiple times, we've spoken so much, and I'm so excited that they're here to really highlight what these new education series are and how to actually look at the modules and get a little bit more detailed. And I am just going to stay quiet and let you two lead. So I'll allow you to take a moment to screen share. I'll stop mine in case it blocks yours. Okay.
All right, are we good?
Okay, I see your screen.
Awesome. Thank you so much.
Of course.
Melissa and I are excited to be here, and we always appreciate the opportunity to collaborate with OWNS. This evening, we're going to do a brief overview of the ANA and what we have to offer healthcare practitioners as far as trainings and certifications. And we'll also have some time for questions, so please feel free to add them to the Q&A as we go along. The American Nutrition Association is a nonprofit organization dedicated to advancing personalized nutrition to combat chronic disease. Our mission is to champion the science and practice of personalized nutrition, and we do this through our nutrition education, our certification, and our advocacy efforts. The ANA offers a range of training programs and certifications for health professionals and advocates for integrating nutrition into healthcare. The ANA believes nutrition is a key component of health, emphasizing the importance of personalized, science-based nutrition for all. We currently offer 4 distinct certifications for healthcare and nutrition professionals, but today we're going to focus on the 2 most relevant for optometrists looking to incorporate personalized nutrition into their practice. So we've got 2 certifications outlined here. On the right, you'll see details about the Certified Nutrition Specialist or the CNS certification. So this is the certification that Dr. Lipsky was speaking about in her presentation and that she holds. This credential is designed for health professionals with advanced degrees in nutrition or related fields, and it distinguishes them as an expert in personalized medical nutrition therapy. To qualify for the CNS, you must have a master's or doctoral degree. You have to complete 36 semester credit hours of coursework and also complete 1,000 hours of supervised practice experience. In addition, it also requires a board exam, which consists of 200 multiple choice questions and is offered twice a year. Once earned, the CNS recertification requires 75 continuing education credits every 5 years. In addition, we also offer the Certified Personalized Nutrition Practitioner or CPNP, which we're going to go into quite a bit of detail about this evening. This certification is tailored to healthcare practitioners who already have nutrition within their legal scope of practice. So this one is perfect for optometrists. The certification identifies individuals with foundational knowledge and skills in personalized nutrition and focuses on integrating nutrition into their healthcare practice. To qualify, practitioners need at least a bachelor's degree in nutrition, dietetics, or a health science field, or a master's degree in health science or medicine. The core training requirement for this certification is our 44-hour online course, which is called Integrating Nutrition into Practice. And I saw in the chat earlier that somebody had already purchased that this morning. So we're great to see some more people taking part in that. We're going to give a lot of details about the training tonight. It's really a fantastic way for you to learn how to incorporate the nutrition that we talked about this evening directly into your practice. So in order to qualify for this, practitioners must hold a state license or a certification to practice. The CPNP certification exam includes a 100 multiple choice question exam. We offer it year round, and you can take it online. And then it does have a recertification, which requires 30 continuing education credits every 5 years. So let's dive into the integrating nutrition into practice training. So this is what is required or is the prerequisite for the CPNP certification. This program is a concise, clinically focused course. It's designed to equip healthcare professionals with the skills and knowledge they need to not only apply personalized nutrition to practice, but also know when to refer out, just as we were talking about a little bit earlier. It covers the latest advancements in nutrition science, assessment, and practical resources to create tailored nutrition care plans for individual patients. As mentioned, OWNS members get an exclusive 35% discount on the Integrating Nutrition into Practice program. This program includes 12 self-paced modules. Each one is online. The entire program offers 44 continuing medical education or CME credits, and it includes engaging videos, slides, literature, and clinical reference sheets, which are all designed for practical use with your clients. So I saw earlier someone in the chat had mentioned during Dr. Lipsky's presentation about how do you recommend that we provide all this information to our patients. And so that's what this course is created to teach you, but also to help understand when it might be necessary to refer out to a certified nutrition specialist or another nutrition professional. So here we've outlined the 12 modules that are included within the program. The first 2 modules provide an introduction to personalized nutrition, and they do a really good deep dive into personalized nutrition assessment. So it helps to learn those signs and symptoms that you'd be looking for as a practitioner, in which cases nutrition could be used to treat or when to refer out. We also have modules on GI health, microbiome, metabolic and hormonal health, among others. And then the final module focuses on behavior change and motivational interviewing, which we know are critical skills for achieving sustainable health outcomes. So I will turn it over to Alyssa. She's going to talk a bit about a few of the specific modules and the learning outcomes from those modules.
All right, thanks so much, Amy. So happy to have you all here tonight. So I'm going to do a little highlight of some of our modules and how our specific programs fill gaps that are often found in your typical training during your education. So as it relates specifically to the gastrointestinal health and microbiome course that we have here for 6.5 CME, we often find that healthcare providers lack that expertise in personalized nutrition and specifically how it relates to the direct applications of gastrointestinal health. We can see how with this training, it really gives an optometrist or a healthcare provider this opportunity to tailor individual genetic and metabolic and microbial profiles to optimize vision and eye care in their clinical practice. And so when we have assessed the surveys and the learners across all 12 modules, we found that on average, there is a 50% increase in understanding, skills, and ability to actually implement personalized nutrition strategies after the completion of these modules. And, patients are increasingly aware of how nutrition and lifestyle affects their overall health. So there really is that expectation that that's addressed in these specific visits that they might have to your office. So in this case in particular, we'll focus now on the cardiovascular module. So again, it's really that the opportunity to provide that really precise and effective nutritional guidance from this course to address inflammation as it relates to cardiovascular health. And of course, there is that connection between cardiovascular health and ocular health as well. So in this case, after taking this course, healthcare providers actually reported a nearly 60% increase in their understanding of the role of inflammation, and a 55% increase again in that ability to actually apply the personalized nutrition strategies to support their patients. And again, just thinking how that relates to eye care, hypertension, or poor circulation, and how that can cause retinal damage as it relates to cardiovascular health and optimizing that. So Amy, I'll have you go to the next slide there.
I'll go back one because I know I jumped ahead on you.
Oh, no, you're fine. It's all right.
Okay.
You're great. Thank you.
Okay.
So we'll go to that behavior change slide. Just one more. Perfect. Thank you. So just taking an opportunity here to talk about behavior change, which is such a key aspect in getting our patients to move out of thinking about something to actually doing something. And in fact, when the public in general is surveyed, they have expectations that their primary healthcare provider, that whether that's through primary eye care or through general healthcare, that these people are trustworthy sources of nutrition and they are expected to provide nutritional care during these medical visits. And so we focus this module on giving you the tools as the clinician to really implement motivational behavior strategies, interviewing into your private practice conversations in order to ensure that your patient is moving from information to active practice of these personalized nutrition interventions. And we'll go on to the next slide, but I will also just mention that patients are at least 3 times more likely to implement a nutritional intervention if they've been coached to do so by their care provider. So yet just another example of that benefit as well. We wanted to just show you a brief look at one of those clinical reference sheets that Amy referenced to. So these CRSs, as we call them, are peppered throughout the 12 courses. Just given some of the topics that we've talked about today, we have CRSs on heavy metals and environmental exposures, clinical reference sheets on addressing metabolic disease risk, and on immune health. So there are many opportunities, not only for you to walk away with materials, but also to really focus in on specific topics for your patient population. And then Amy, I'll have you go through one more slide. Excellent. And so this is really just a summary again of those gaps in knowledge that often occur and how our programming can really fill those gaps and really ensure that you're bringing these tailored nutritional recommendations into your practice and enabling your patients to optimize their health. So I will pause there and ask if there's any questions.
Thank you, Alyssa and Amy. Let me see if there's anything in the Q&A. Nothing specific in the Q&A for the certification process. I want to also emphasize one part of the certification that many people have taken advantage is the point system that is used with the ANA is also accepted for our fellowship for the Ocular Wellness and Nutrition Society. So we've had a fellowship program for, I lost count the amount of years. I was co-chairing it at first, and now we have Dr. Abbott chairing our fellows. So those points take a huge chunk of your fellowship points out. So it really helps our fellows receive their fellowship for the own society as well. So I want to emphasize that you can kind of put it towards your fellowship with owns. The one part I think with the CPNP that's really great that I've heard is the time. So meaning, it's not as time consuming as maybe some other programs. What have you guys seen in terms of average? I know you may not have that button in front of you, but what's the average that's taking people to finish the CPNP, the full program?
Sure. So you have access for 12 months. So once you sign up, you have a year to take it. But there must be a good deal of excitement once people get started, because we're seeing people complete it, within a couple of months and wanting to take the certification exam. So it is 44 hours, and that would be if you didn't include any of the extra optional readings and things like that. So, you're looking at spending at least 44 hours on it, but it's really well laid out so you can do it at a self-pace. The videos are not really long, so you can watch, one a day and really fit it into your schedule. So you could
Yeah.
easily do it in a couple of months and get the certification under your belt pretty quickly.
And I think that's one of the key elements. Originally we had the CNS path. This was 5+ years ago, something like that. I did go down that path. It was a great path. And it gave me a lot of foundation for education and for, doing what I'm doing now, but also knowing that, for more of an easier way to start getting that foundational education without going down that full path of nutrition, certified nutrition specialist, which we still have some doing that path. It's not a bad path. It's just longer and it takes a little more effort. Having this capacity, this ability, because at the end of the day, we don't have any lecturing, maybe one course, maybe a half a course, maybe just a lecture in optometry school in particular. And if there's MDs out there, it's lacking also in the medical education, that there's no quick fix, and the only way is to actually learn. And it's just a very easy to use program. It also is open to MDs and ODs. So that's another point that, if you don't have that time to go quote unquote back to school fully, this is a really good way to, inject that foundation, because we need that. And that, to me, builds confidence. The confidence builds the verbiage. The verbiage makes change for your patients. And that's, that last module of behavior change. Every time I do an article, I always try to inject something about behavior change, because it's such an essential component of being a practitioner. Even if you're not a health coach, even if you're not a nutrition, just being a practitioner, behavior change and understanding behavior change is so, so critical. And we don't learn it. So, yeah, so it's a quick turnover. So maximum it's about a year, but most of of the signups have not been a year. And we notice it on the own side. So, I would really encourage at least investigating what those modules look like in your life. And, we extended this. We did it for 1 year. We were going to say, just how's this going to look? And we've had such positive feedback that we're going to continue this, because there are more people that want it. So I'm just very excited that it really gives doctors a way to access nutrition education without going full-fledged back to school, but also, it's well written. I know quite a few of the lecture writers, and it's well executed. So thank you for doing that, and thank you for, offering it to OWNS, because we really have a really good amount of docs out there that are thirsty for this education, and it's not, given in the masses. So I don't know if any other Q&As popped up. So when searching the certification on the website, do you say it is called Integrated Nutrition into Practice? So actually, that's a great question, because I think it can be confusing to some. I call it the CPNP because I want everyone to finish it and get their certification, because I'm all about going to the end. So if you can just kind of highlight what that is, the difference.
Yeah. And we can put a link in the chat too. And if you're an OWNS member, it's best to go through the OWNS website to reach it so you can get the discount code. But the training that you take to get the CPNP is called Integrating Nutrition into Practice. So that's where the confusion kind of comes in. So the training itself, Integrating Nutrition into Practice, the certification you can earn through the training is the Certified Personalized Nutrition Practitioner, or CPNP.
Correct. And also then those credits then go into your fellowship if you decide to go down that path. So CPNP is the ribbon at the end, the prize at the end. There was another chat. I think somebody went down the path with the previous path with University of Western States. 2 classes were very time consuming, weekly post lectures, and there was a weekly one-on-one with pre-recorded lectures. So are there weekly chat posts that need to be done with this system? No.
It's
I-
all at your own pace. So you watch the videos, you read through the literature and then take a quiz.
Yep.
So it's all at your own pace. It's not at all timed out or like that is or has those requirements. And I did see that Karen had shared that the CPNP helped her feel validated in discussing nutrition with her patients. So that's exactly what we're going for there, is that you have the information you need to then share it with your patients and then
Yep.
also know when to refer out.
Exactly. And then actually, hi Millicent, how are you? We have a question about business implementation. So, and this is a big question. This is like a healthcare question. Any guidelines with business implementation within the program? I'm going to say a loose yes-ish. And then that's part 3 too. We have some tips for business. But if you wanted to shed a little light on that question.
Yeah. So that's where those clinical reference sheets really come in, because it's going to talk about how to implement the things that you're learning directly into your practice. And then also, supplements and lab work are talked about very extensively in the training. So those are called out. So the goal is that after you finish each module, you can directly take that back into practice immediately. And it's kind of like the Mediterranean diet handout. We want you to implement it as soon as you can. So you don't even have to finish all 12 modules before you're already bringing what what you've learned into your practice.
Perfect. And and also I will comment on that, and that's something like every practice is very different too. So, I mean, I've worked in 30 plus practices and I've seen a lot of different modes of practice, and you may have to cater it a little bit differently per whatever however you're practicing, what type of setting you're in. But again, the foundation is key and the implementation is obviously key, but I think we're on a path of getting better at that, right? The more we give this education and give confidence, I think more and more people are going to figure out how to bring it into practice.
And Neda, if I can just interject there, I think that's such a beautiful setup and correlation of the clinician's own health and ability to apply nutritional interventions into their own life is directly correlated to their capacity to share that with their patients. So perfectly said, you're taking the course not only for your own edification, but also for your clinical practice.
Yeah, and it's walk the walk, right?
Hmm.
Because we have to believe in it, because that's the core of it all. You have to believe that this is the right way to treat your patients. And then things kind of simmer out of that. And I'm a true believer that that energy, when you do believe in it, truly exudes within your clinical care. And it's just we just need more of you to do it. And I know that you're out there. Okay, so I think this is great. I would like to conclude. A huge thank you to Alyssa and Amy. I know you guys have been working super hard with the ANA, and there's so many great things coming your way, and I'm just so happy about this collaboration. So I am going to conclude and start sharing my screen.